to Friday. Tomorrow here in Victoria, and then Wednesday, Thursday, and Friday at the Cabinet offices in Vancouver. And with that, I'm going to introduce Dr. Henry.
Good morning. Thank you. It has been a challenging weekend and a weekend of change where we've been watching what has been happening both across the country and around the globe with COVID-19. And as I know everyone in this room is aware, the situation is escalating around us and here in British Columbia as well. And there are things that we need to do now to take action to protect our citizens, our communities, our families here. I'll start off by giving you a sense of the numbers that we've seen in British Columbia over the last 2 days since we last talked. We've had 30 additional cases identified to bring our total up over 100 to 103 people who've had this disease in British Columbia so far. Having said that, we know that there is ongoing testing being done and quite a lot of tests that are in the works at the moment. With all of those cases, however, there are 6 people in hospital now, and everybody else is in stable condition, being managed at home. We've had 5 people who have met our criteria to be fully recovered, although there are many more whose symptoms have resolved, and we're just waiting the testing to be able to consider them as fully recovered as well. The sad news is that we've had 3 additional deaths that have been reported over the last few days, and all of them have been residents in the Lynn Valley Care Centre, where we know we've been dealing with an outbreak for the last week and a bit. We also just want to note that we have increased cases in both Vancouver Coastal Fraser Health, as well as new cases here on Vancouver Island and in Interior Health in the 30 cases that we've reported here. One of the other things that's become apparent is that there was an event that happened in Vancouver on the 6th and 7th of March, a large dental conference, and at least 4, possibly more, of our cases are related to that dental conference. And that is very concerning to me. We also know that cases have been identified from that conference at other provinces across Canada, and my instructions are to anybody who was at that dental conference, and we'll have the full name in our statement, needs to self-isolate immediately. They should not be at work, they should not be at school, they should not be around others, and this is the critical time where we're starting to see people turning up with illness related to this conference. So that's an important thing that we're saying to people both in BC but across Canada and internationally who attended that conference. We do know that there's a number of measures that have been taken across the country, and we are in discussions as we're still in spring break here in British Columbia, and I have talked before about the role that we will have in school operations following spring break, and we're in active discussions about how to best manage school operations to both protect students and staff and to make sure that child services are available where they're needed. I also want to talk again about the advice that we gave, or the direction that we gave for anybody who's come into Canada, and particularly into BC from anywhere outside of Canada, that they are expected to be in self-isolation for 14 days from their return. And I know there was challenges over the weekend with the messages that were given out at the airport, but I understand that that has been finally changed, and so as of at least my understanding is late last night, people are being directed correctly that they must stay in isolation. And this is incredibly important for us. The vast majority of our cases have been imported cases, and we now recognize that there are no safe places around the world People are being identified across the United States. People are being identified in countries that may not have recognized that they have transmission of this disease. And additionally, we have people who have been identified with COVID-19 from multiple cruises in many parts of the world. So this is incredibly important for our community right now, that everybody who comes into BC has been outside of the country, needs to stay at home, needs to stay away from work, needs to stay away from school, needs to stay out of our communities, so that we can break those transmission chains, we can stop transmission. We can't do anything if somebody has already been exposed to this virus, and if they've been exposed to this virus elsewhere in the world, we can't help them unless they stay away from others. And so that is what we are asking people to do. The good news is, of course, that most people that we are seeing who have been traveling internationally, most of them have relatively mild disease and are staying in isolation at home and are developing and being able to manage their disease at home. We are taking a few additional measures as well. Last week, I had issued a provincial health officer order cancelling all gatherings greater than 250 people. And across the country this weekend, we've had discussions with my colleagues, and we have moved that now to cancelling all gatherings greater than 50 people. And that's aligned with what we're seeing in the United States, and I know that will have an impact on many people. But we have also seen that businesses are taking responsibility, municipalities, other agencies, and are shutting down places where people are gathering. And this is going to be really important for us for the coming weeks. And I've said this before, this is not forever, but it is important for now and for the foreseeable future, for the next few weeks. The other things, I've provided advice to our Attorney General for closing of casinos, so all of those will be closed across the province as well, recognizing that those are areas where people who may be at higher risk congregate. So as I've said, this is a very challenging time for all of us. One of the other measures that we'll be taking is, and Minister Dix will speak more about it, is some of the measures around our hospital system to get us prepared for the chances that we might see more people that require hospitalization, require critical care, so that we will be stopping and cancelling scheduled surgeries across the board, and the hospitals will be taking additional actions to prioritize urgent patients, to cancel elective patients, and preserve urgent and emergent care in our facilities. We'll also be stepping up the protection of the most vulnerable in our communities, in our long-term care homes, and protecting our seniors as best we can. So that will mean that we have to run the risk that seniors will become less connected to others in the community. And I'm asking for people to step up and help us communicate with our seniors, whether they're at home because of in their own home, or whether they're residents of long-term care homes or assisted living facilities. How important it is for us to come together as a community, to connect on a daily basis at least with the people in our community who are in isolation and who aren't able to have visitors. So in this challenging time, this is what we need to do now. This is what we need to do in our community to keep people safe, to keep our families safe, and to stop this virus from having the impact that we've seen in many other countries around the world. So I'm asking everybody in British Columbia to do our part, to support each other as we get through this crisis in the next few weeks, and we will continue to keep you updated as we move along this.
Thank you very much, Dr. Henry. First of all, as all of you know, the Prime Minister has just spoken to the country about changes that many of which the Premier has been advocating in meetings over the last few days to tighten access to Canada at the borders. And while we're very strongly supportive of most of those changes, we note that we remain concerned that access from visitors from the United States continues situation, particularly in King and Snohomish County in Washington State, which affects British Columbia more than anyone else. It's our strong view and it's our strong message that visitors from the United States not come to British Columbia. Don't come, because at this moment, that is the wrong thing to do. We understand that people are being asked to self-isolate, but better than self-isolate for visitors is not to come. As Dr. Henry has said, it's a very serious and sober report about the number of cases. We now have 103 cases in British Columbia. 6 of them, and 6 alone, are currently in acute care. 4 people in total now have passed away, and we are very, very sorry about that, which is a very sad situation, and we pass on our condolences to their families. And as noted, 5 have fully recovered. Today we announced the new cases include cases in the Fraser Health Authority, the Vancouver Coastal Health Authority, Island Health, and in Interior Health. I want to just highlight the very significant measures that Dr. Henry has touched on today. Fundamental changes to our acute care system, fundamental changes we are making in order to ensure that British Columbians are safe, and that particularly our acute care facilities are ready for a changing situation. First of all, as you know, British Columbia health authorities are directed to immediately move all hospitals in the province to outbreak response phase 2. This means hospitals will only undertake urgent and emergency procedures and will postpone all non-urgent scheduled surgeries. This will result in the cancellation, and it'll be implemented over the next 3 to 5 days, the cancellation of thousands of scheduled surgeries, of elective surgeries in British Columbia, and free up, as you would expect, hundreds and hundreds and hundreds of hospital beds. In addition, we are working, of course, with the extraordinary staff who provides scheduled surgeries in the province to ensure that they are moved over to support urgent needs in the hospital in critical care. And we'll be working with surgeons and anesthesiologists, nurses, and cleaning staff to see that happen in the most effective possible of ways. As Dr. Henry has said, in particular, Lions Gate Hospital in the Vancouver Coastal Health Region is directed to move to outbreak phase 3. This means the hospital will only accept emergency patients. As you know, Lions Gate has had cases in the facility of COVID-19, and this is an appropriate response. I note that we are also moving to acquire more access to long-term care beds so we can decant people from acute care who don't need to be there and provide more space for activities in acute care. Taking collectively these decisions, the reallocating of staff, again, will enable us to access hundreds and hundreds of acute care beds, and we will be reporting on those developments over the next 3 to 5 days in our daily briefings. We're also making some significant changes in primary care. Today, the College of Pharmacists has also been directed that pharmacists refill British Columbians' prescriptions without requiring an additional physician's note. This will save time in doctors' offices and allow us both to protect people in the system and also to ensure that doctors can focus on more urgent matters. We'll also be providing physicians with compensation for providing virtual care services in an effort to increase services and increase access to care and services and reduce COVID-19 transmissions. As Dr. Henry has said, we intend to move to restrict visitors in long-term care to essential visitors only. We've requested all health regulators begin emergency registration of non-practicing or retired healthcare professionals. We are also asking them to register healthcare professionals from other jurisdictions, should they be available, and the armed forces. We are issuing a new order prohibiting gatherings of more than 50 people. Dr. Henry said that earlier, and she will be issuing that order. On the recommendation of Dr. Henry, the Attorney General has ordered all casinos to close until further notice to reduce the risk of COVID-19 transmission. This order comes into effect at 11:59 a.m. today and has been signed by the Attorney General. We are consulting with education stakeholders today to discuss potential recommendations for school operations following spring break. We have 2 weeks where schools almost everywhere in the province are shut down, and we expect a formal announcement on this tomorrow. And in an effort to allow 811 healthcare professionals to support more people who are experiencing COVID-19 symptoms or who require assistance with other health issues, the province has created a dedicated phone service to provide British Columbians with information. That's 1-888-COVID-19 or texting 604-630-0300. Information is available in more than 110 languages. Those measures taken together are significant measures both in the acute care system and the primary care system to ensure that we are ready as the situation continues to evolve and develop. They are significant changes, and we do not underestimate the consequences of those changes. We spend a lot of our time in the healthcare system ensuring more rapid access to scheduled surgeries and to elective surgeries. And of course, for all of the people involved, it is very important. We do not take it lightly, but we believe, in spite of the fact that there are only 6 people in acute care today, we have to prepare our hospitals, and I think in all health regions, without exception, this will be true. Obviously, with a particular and urgent focus right now on the Vancouver Coastal Health Region and the Fraser Health Region and the Provincial Health Services Authority. Finally, I just wanted to say that Dr. Ryan of the World Health Organization spoke about the issue of pandemic, and he said the most important thing wasn't the pandemic, but it's how we respond to it. And we in British Columbia and Canadians and people in British Columbia are prepared to fight. That is what we are doing in the system, and I think it's very important that we find our own agency to achieve that goal. We're asking all British Columbians to be part of this. We've said it many times. We need to wash our hands. We need to not touch our face. We need to throw away Kleenexes. And most importantly, we need to stay home if we're sick. Stay home from work, stay home from school, don't visit our elders, etc. This is critically important. It is our civic obligation. If people have traveled outside of Canada, they must self-isolate. They must self-isolate in order to protect. It is, again, our duty as people living in a community, our duty to the ones we love, and our duty to British Columbians that we do not know. This allows us, I think, to do what we've been doing, to push and to attack for more than 9 weeks now, to push and to attack and to adjust and make changes in order to take all the steps we can to contain and slow the spread of COVID-19 in British Columbia. We will continue to do that, and I look forward to taking your questions.
As a reminder to everyone in the room and on the phone, it is one question, please. We will exhaust the room, go to the phone, and come back to follow-ups. So I have Bonnie, Tom, and Keith.
If you had to do all over again, would you have done some of this sooner? Because it looks like British Columbia is now behind the curve in its responses rather than ahead. And also, were you told about that dental conference in advance? And if so, why did you let it go ahead?
I'm not prepared yet to start second-guessing what we did. We did everything that we could to try and contain this. There were things beyond our control, certainly, and particularly what's been happening in the United States. And we took the actions that we were based on science, were based on what we know. We've taken some very strong actions quite early on, and certainly our testing strategy, I think, has protected us in many ways. And now we've adjusted our testing strategy to make sure that we can best identify what we need to now. And no, I was not aware of the dental conference. We were not consulted on that, it was at a time when I was advising that medical conferences in particular should not be held. But I'm very disappointed in that fact.
Tom.
This is a question about people working from home. WorkSafe BC has risk and hazard identification requirements for employers that don't normally work at home. Will there be some relaxation of that, some changes if necessary to ease those rules so that employers can take the initiatives that you want us to take here?
Yeah, I think employers, for the most part, many of them have policies in place already that ensure that these rules are met. I think the basic safety ones, of course, will not need to be eased, but I don't know the details of them, so I can't really talk about that, but I can certainly find out.
Yeah, and just to say that obviously this is an urgent priority, and I think employers and employees need to act to ensure that everyone stays as safe as possible. Encouraging people in working at home is important in that, and if people have particular issues, they should raise them. We've noted as well, and I didn't mention it in the list of things that we're doing, we noted as well that there is none for sick notes in this time, that we need to, as we've said with the renewal of prescriptions and for sick notes, there's no need for that sort of thing at this time. We have to reserve our primary care services for the services that are required.
So there are 6 people in the hospital right now from this, which is 6 beds out of almost 7,000 beds. So you're canceling thousands of surgeries. So is the expectation and fear that our hospitals are suddenly going to see many COVID-19 patients in a relatively short period of time?
They're clearly going to see more cases, and we have to prepare for that. So initially, once we've done these initial measures and canceled thousands of surgeries, they're going to be, for a period of time, inevitably empty beds. But we think this is a necessary step. You have to prepare. Again, we don't need it for today, and we might not even need it for Friday, but we need to have it in place so that we're ready for that circumstances, well prepared for that circumstance, and so that we're both in decanting what are sometimes called alternate level of care patients or ALC patients on the one hand, and on the other hand canceling scheduled services. This also allows us to redeploy some of the most outstanding staff in BC healthcare, those involved in the surgical process, both doctors and nurses and many more, and healthcare workers to prepare for more urgent priorities.
So some of the attendees at this Pacific Dental Conference have either returned home or and potentially have been seeing patients during this time. Do you have any guidance for people who are wondering if they had a dentist appointment recently, if their dentist might be a source of concern?
Dentists and dental hygienists are healthcare professionals, and I would hope that none of them would work if they were ill, and that's where we know the risk is with this for the most part. Dentists also take infection prevention and control precautions within their offices. So unless you have been notified by public health that it's a concern, then I think most people are fine, but I'm putting the word out today. People did receive a letter. Anybody who attended that conference received a letter saying that there had been an exposure event at that conference, and we're now starting to see people who've turned up become ill. And I suspect in retrospect there was more than one person there that was incubating or was sick with the virus and was passing it on to others. So this just became apparent when we looked at some of the exposure histories of people who became ill over the weekend. And so that's why I'm putting the word out today that everybody who was at that conference needs to stay home.
Sort of a follow-up to that, plus another sort of. Rugby Sevens was happening the same weekend in Vancouver. Is there concern about that? And you said you're going to talk about schools, but daycares are still in right now.
Absolutely. Yeah, and daycares are also a really important part of our community that we're in discussions about whether we need to take any measures around daycares as well. The Rugby Sevens is a very different risk. Then we're talking medical professionals who are coming from various parts around the world and around the country. So there was a very detailed risk assessment done with the Rugby Sevens, and I was confident that the right measures had been put in place for that event, given the types of risks that were available at that event.
Excuse me, Dr. Henry, that you said earlier about things are beyond your control, whether events happening in the United States. And I know we've had these briefings where travel is a federal issue, but the minister was just saying that he does not agree with the Prime Minister's new policy on travel. Is there anything you as the health minister can do to prevent travelers arriving here that you think are putting the population at risk?
So I think I said some things are beyond our control, not everything. And, you know, that's clear with this virus. There are many things sometimes that are beyond our control. Border issues are a federal issue, and we know for cruise ships, we know for a number of other things that these are federal issues. We do try and influence them. And yes, I have made our concerns known about our land border. There are clearly reasons that we need to have crossing of our land borders for essential services and goods, that we have very integrated supply chains with the United States, and we need those things. And that's fine. It's people who are coming here to visit that we have concerns about. And at this point, at this time, we don't want people coming to visit that might put people here at risk of COVID-19. So we can make the requirement that anybody who comes in needs to self-isolate, and if that's a visitor and they want to come to the Butchart Gardens, then they self-isolate for 14 days and they can go on day 15.
And just to say, I support all the measures the Prime Minister has taken. I'd like him to take one more, which is to also apply it to the United States to visitors to non-essential traffic. I mean, we think that strong action has to be taken at the border. And I think the situation in British Columbia is such, the situation in Washington State is such, that should be made clear, so that it's not there's not an issue of nuance. It's true that if people want to visit from Washington State, they need to self-isolate for 14 days. But I think in the case of visitors, as opposed to non-essential people who aren't involved in the transportation of goods and services that are necessary for our society, I think clearly we're saying to people, don't come.
Just to follow, just jump in there.
Thanks, Gerard.
You mentioned that there were cases on the island or in Island Health. Are you able to give us any more information on how many or where they are? And then just going along with that, there was a doctor in the Comox area who did confirm that one of the cases was up there. Is she right or wrong?
Yeah, so there are 7 cases that have been, new cases that have been identified in Island Health, and they're in various areas in Island Health.
I guess for people who are being told to stay home, self-isolate, watch for symptoms, maybe they feel a bit sick, what level of uncertainty do they need to, or do you expect that they'll have to deal with? Because some people are thinking they should be able to get through to 811 quickly to find out what they have and whether it's safe for them to go to work or, go about their business as they need to. Is that just not possible at this time, or what level of uncertainty, I guess, should people expect?
We talked a little bit about this. It's very difficult, especially if people have mild symptoms. It's very difficult to know what it is. And at this point in time, there's no necessity to actually have a test for COVID-19. If you're somebody who's traveled, you're been a contact, you're in self-isolation, and you have a mild illness, you don't need to be tested. You just need to stay home and stay away from others until the symptoms resolve. And we have some advice around that will be coming out in more detail as well. And we're working on a way that people can actually go through an algorithm and a self-assessment about what the concerns are and what they can do about it. So to take some of the pressure off of 811. We're also bolstering up 811. The other thing that's really important is, not everybody needs a test at this point. We just know that the way to stop the transmission to others is to stay away, and most people will get better. They will have very mild illness, they'll get better, and that's fine. They don't need to come into the healthcare system. They don't need necessarily to be tested unless they start having more severe illness. So we want to make sure that everybody who needs the test is able to get it, and everybody who needs the assessment and the medical care is able to get it as well.
Okay, Adrian and Dirk, and then we'll go to the phone lines.
Monsieur le ministre, est-ce que, à quel moment est-ce qu'il pourrait être décidé que tout le monde devrait passer le test de la COVID-19?
Excusez-moi, pouvez-vous répéter la question? Je sais pas.
Il est parfois suggéré que tout le monde passe le test de Covid-19, à quel moment est-ce que ça serait décidé?
Écoutez, on a fait plus de tests que presque n'importe quelle juridiction. Maintenant, il faut viser ce qui représente le plus grand risque. C'est-à-dire que si on a des symptômes, il faut rester chez vous pendant une période pour que ces symptômes se résolvent, n'est-ce pas? Donc, il faut que tout le monde reste chez eux s'ils ont des symptômes qui ne sont pas sérieux. Donc, ça, c'est notre consigne actuellement. Nous allons continuer plus vite qu'avant de faire des tests, mais il faut quand même viser le problème général qui va bénéficier tout le monde, et c'est ce qu'on est en train de faire. On a annoncé aujourd'hui 30 nouveaux cas en Colombie-Britannique, y compris tristement 3 personnes de plus qui sont mortes, ce qui est quand même très sérieux. Nous avons remanié et changé, et nous sommes en train de changer nos systèmes d'hôpitaux, de préparer pour des nouveaux cas dans notre système de santé. Il y a 6 personnes en Colombie-Britannique maintenant qui sont à l'hôpital à cause de COVID-19. Donc, il faut préparer l'avenir, et c'est ce que nous sommes en train de faire. Et il faut que des gens participent dans ce processus, c'est-à-dire qu'ils lèvent des mains, qu'ils restent chez eux s'ils sont même un petit peu malades. Et s'ils ont voyagé, de rester chez eux. Ça, c'est essentiel pour tout le monde. C'est la façon dont on va tous participer à réduire la croissance de ce virus.
Dr. Henry, can you tell us a bit more about the 3 people who passed away? That you said they were connected to the Lynn Valley Care Center. What are their ages? Male, females?
I don't actually have those details with me, but they were all residents of the Lynn Valley Care Center who had been part of the outbreak that's ongoing there. And unfortunately, 3 of them have succumbed to the disease in the last few days.
So it just happened today or last night? Or?
Yeah, so the numbers that we're talking about today were the ones up until late last night. So it happened over the weekend since we last talked. And I will say, with the number of outbreaks that are happening, so we have the Lynn Valley Care Center, we've had a number of cases identified at Lionsgate Hospital. We've also had the Hollyburn outbreak. There are a number of other residents of the Lynn Valley Care Center who have tested positive as well. Thankfully, there's been no further residents or staff from Hollyburn at this point who have tested positive.
Okay, we'll go to the phone lines. We have Justine Hunter. Go ahead.
Hi, Minister Dix, can you tell us why we're not seeing a unified response here in Canada? And I'm wondering if BC is alone in having these reservations, this disagreement with the PMO about the U.S. border.
I think that we have had a unified response, but what we've been saying, what the Premier's been advocating for, we have a very significant and particular situation in British Columbia with the very serious situation in King County, in Snohomish County and other counties of Washington State. And so we think even stronger actions are necessary. But every action that was taken, we support. And as for our response, we're working closely together in terms of the obtaining, the buying of supplies and equipment with the federal government, with other jurisdictions. We meet regularly. I'll be meeting with other health ministers shortly today. So I think the response is pretty consistent and pretty strong across jurisdictions. Obviously, BC and Ontario and Quebec acted first because we were the places where the cases first appeared, and we've been acting now for 9 weeks in terms of our response urgently. We put together our emergency response 9 weeks ago, and certainly the federal government was involved at that time. So I think there's lots of unity on these questions. There is right now some disagreement as to one, and that's just whether we should not allow visitors, non-essential visitors at all from the United States who are not Canadian nationals or don't have status in Canada.
Okay, we have Mike Howell from the Vancouver
Hi, I wanted to ask about the H1N1 pandemic in 2009. What lessons did government and public health officials learn from that, and are they being implemented in response to the coronavirus outbreak?
Yeah, absolutely. It was I was very involved with that response as well. And some of the things we learned were about the importance of early communication, about having our organizational structure federally and provincially together. And that's reflected in what Minister Dix just talked about, how we set up an emergency structure across the country and in our province very early on. Some of the testing strategies. Really, our response nationally and internationally is based on our pandemic influenza response. There are so many things that are very similar. There are some things that are quite different. So it has to be adapted and changed. And we often say a plan is the basis for change, and that is what we've been doing with this plan. But a lot of what we learned from H1N1 is very applicable to what we've been doing in the last 9 weeks and will continue to do. We did see as well in H1N1 that young people, young adults were often affected, and there was a lot of young adults that ended up in our intensive care unit, sometimes requiring ventilator capacity. So the things we learned about that and about how quickly that could happen and about what types of ventilators we needed to have and what the limiting factors were, the bottlenecks, if you will, in the province about access to ICU care and ventilatory support. Those are all things that we dusted off and are making sure that we are as prepared as we can be for any potential increase in COVID-19. And I do think it's important to say, it's not inevitable that we are going to get major surges over the next little while. I think we need to be really careful and prepared for it, and it is inevitable that we will see additional cases. But if we're all doing what we need to do around social isolation, social distancing, making sure that we do everything we can in our families and in our communities to stop the transmission of this virus, we can flatten that curve and we can manage. So that's why we're taking these actions today, and that's what we're talking to everybody about. We need to do these things now, and it is the best that we can do to protect ourselves and our families and our communities here.
Shannon Patterson from CTV, go ahead.
Hi, Dr. Henry. Can you talk a little bit more about this dental conference? How many local people were there as opposed to international visitors? How many people do you know how many people have tested positive that are here in Metro Vancouver? And are you guys trying to reach out to everyone who attended this conference? How are you trying to track them down? It sounds like it's pretty urgent that this was a real place of spread.
Yeah, so this is, I don't have the details. I understand there was about 15,000 people at the meeting, somewhere around there. They did all receive a letter last week from Vancouver Coastal Health, and we talked about that because we knew there was one person who had attended that conference who was only there for a very short period of time, but had developed symptoms while they were there. It is clear to me because I've seen across the country, and this only became apparent late yesterday, that people whose only source of contact was the dental conference have appeared in other provinces as well. I know in Alberta and I believe in Ontario as well. And then as we got the information about some of the new cases here in BC, there was at least 3 or 4 that were also, that was their only exposure that was known. So it is something, I don't have the details yet, but we will be sending out again messages to people that they, and what I'm hoping you will put out there is that this is really urgent. We're now at that point in time where people are starting to show symptoms. So that's where we see in the 14-day incubation period that around day 5, day 6, day 7 is when people start to get sick. So they need to be actively self-monitoring and right now self-isolating, getting out of the workplace, staying away from others so that they are not transmitting it to their family, to their patients, to their community.
Okay, Aaron MacArthur from Global News.
Oh, hi there. It's Aaron MacArthur at Global News. I have a question about lag time between the number of cases you report and the actual number of cases, how far behind is the lab, and does any lag have an impact on our growth curve?
Yeah, absolutely. And we have an epidemic curve, and we'll start to be putting it out in a more formal way in the coming days, now that we're no longer case-by-case reporting, as you've noticed. So the lab was very up-to-date until very recently, but because we started to see increased numbers of cases of people requiring testing, particularly since we asked all international travelers to self-isolate, there was dramatic increases in people requesting testing over the last few days. So we are several days behind now. And the lab is working at capacity, but we are adding capacity as fast as we can. So the confirmed cases, the ones I'm reporting, are the ones that were tested as of last night. It takes some time as well for the public health people to connect with each of the cases and try and determine, was it travel related, where was the links. So we want to get that information. So we will have information that is up till the morning of the day when we have afternoon briefings, but today's reflects up to the end of Sunday's lab testing. So it does give us a little bit of a delay. On the other hand, every single person who has been tested has been put in isolation, whether directly by public health or by their family doctor in self-isolation, awaiting the test. So people are not out and about doing their business. If they've had symptoms and they've been tested, they are in isolation awaiting the results of the test.
Andrew Wu from the Globe and Mail, go ahead.
Hi, Dr. Henry. I was wondering, after the initial positive test linked to the Lynn Valley Care Center, why only one floor was locked down, and what's locked down now? I ask because we've heard that a nurse in the other much larger building has tested positive as well, so we're wondering if you can confirm that the virus is now in that other building.
That's not my understanding, but the outbreak report that I received from Vancouver Coastal was that they were continuing to find cases popping up in the one area. There are a number of buildings around the care center, so I'm not aware that it's been detected in any of those other buildings at this point.
Okay. We have Megan Turcotto from Global Okanagan. Go ahead. Okay, I'm going to move on.
Hello, Megan from Global Okanagan. Is this the right time?
Go ahead.
Yeah, my question is around transparency. We're hearing concerns from some residents in the interior that they're not hearing directly from Interior Health, and when we do request interviews with them, they're directing them to the province. There's also been some questions raised about the fact that we're not seeing where in Interior these cases are, and I know you've said this is for privacy reasons, but it seems like a double standard when specific facilities in the Lower Mainland are being named, and the concern is that this is going to create unnecessary fear and rumors, and it doesn't allow people to make informed choices. Looking for a response to that.
So we have been very much focusing on the provincial picture, and that's why most of the media is being done with us, so that we don't get conflicting stories and conflicting things out there. But the other reason is very much that our public health teams are actively engaged in following up with everybody. And we have had many, many contacts of people who have identified as cases, and it has been incredibly busy for our public health teams. So this frees them up to make sure that they're able to best do that. And like the Lower Mainland, with the exception of outbreaks, which is where we have identified facilities in particular, we have kept it very general to the health authority region, and for a variety of reasons. One, because people we know have been identified by public health if they've been at risk, and that's been the case for school settings and other settings. As it's starting to move into many different communities, we'll see the risk doesn't change what we want people to do and what we need people to do is the same across the health region. And so anybody who is sick needs to stay home and stay away from others. Anybody in the community, we need to take all those important measures like cleaning our hands regularly, covering our mouth when we cough, and so importantly, not touching our face and cleaning regularly and staying away from others.
Okay, Jane Side and North News, go ahead.
Hello, Dr. Henry. I'm wondering if you can clarify what you mean by the phase three outbreak response that you're putting in place at Lionsgate Hospital, and also how this is different than the response you're putting in place at other hospitals, and why Lionsgate is being put on a higher level of response.
Yeah. Excuse me. The issue with Lionsgate Hospital, as reported last week, is that they've had some cases in staff at that hospital. And so it is what we consider outbreak. So they are on an outbreak protocol that makes sure that we're not transmitting within the hospital, or that people who might be incubating the disease aren't transferred to other facilities. So they've stepped up the response at that hospital to make sure that we're not having increased transmission, and people are being monitored as well within that facility. So everybody else, we do not yet have any evidence of transmission within other hospitals, but in Lionsgate they are on a different outbreak footing because of that.
Gordon Hoekstra, Vancouver Sun, go ahead.
Well, hello, Minister. I'm just wondering, has the federal government told you why they will not shut the border down to non-essential visitors from the U.S.? I mean, at minimum, the Washington State to BC border.
Well, I think the Prime Minister did say that they weren't closing the border to U.S. visitors at this time. I think it's an evolving situation. I think they took very strong action in a lot of areas today, action which is designed to prevent transmission, and we've been asking them to take strong action at the border, and we're just going to continue to advocate on that question. I should add, though, that, and it's important, that visitors, just as everyone else, should they come to British Columbia, are expected to self-isolate. So as Dr. Henry has said, if they want to visit Stanley Park or Butchart Gardens or anything else, they would have to wait in self-isolation for 14 days and then go on day 15. And so I think as a practical matter, as long as that is fully enforced, I think it's a good measure, but I think we can do better. I think that the application for non-essential, non-movement of goods and services across borders, which is essential for all modern societies, I think that in addition to that, we would hope that because of the serious situation in Washington State, that they would consider adding that one other provision. But as I said, I think the other provisions suggested by the Prime Minister are good provisions today, and they follow through on repeated calls from Premier Horgan.
Okay, Richard Zisman, Global News, go ahead.
Dr. Henry, has there been any change around BC ferries? And to the issue around dentists, are you concerned that any dentists affected at that conference have worked on any patients here, and why not shut down dental offices across the province?
Yeah, not all dentists attended the conference, so we're not aware of risk in any other dental offices, and they are a healthcare profession. I think the Dental Association has been looking at this and been working with the dentists as well around what are the protocols should we start to see more community cases to both protect people who are in dental offices, but also in some cases to reduce dental services to only people who have necessary or urgent or emergent need urgent or emergent dental care, and that's part of our pandemic planning process. In terms of BC Ferries, we do understand that people will be able to stay in their cars on the ferries in BC for the termination, at least for the next coming weeks. And that's a measure that we've heard from the federal government will be implemented soon as well. So I think that's good news.
Bill Metcalf, Nelson Star, go ahead.
Hello, Dr. Henry. I'm calling about rural areas. First of all, I wonder what the numbers are for the Interior Health Authority, and is there a difference in capacity to test people? This is about testing between small rural areas and other areas.
As far as I'm aware, there are 2 cases in Interior Health at this time. And I know other people are being tested. Yeah, it is a challenge. As you know, the rural areas are quite spread out and they don't have as much risk, but there are consequences if somebody is positive, and transmitting in a rural area can be much greater. So those are things that we've been looking at both for the interior and the north, to how to ensure that access to testing is there when it's needed. And I mean, it is a challenge. How do we get the test out there? They've done some very innovative things in many places, both in the north and the interior, where a public health nurse will go to somebody's house, or a medical health officer will do it, or will have somebody go to a healthcare facility and do a drive-by test in the parking lot. So there are ways that we've been trying to get around that, and I know Interior and the North are looking at how they can best do that within their populations.
Marie Weisgarber, CTV, go ahead.
Hello, Dr. Henry. Hello, Dr. Henry.
Hello.
Can you hear me?
Yes.
There, can you hear me?
Yes, we can.
Hello. Okay, great. Thank you. I just have a question about what the message is for bars and restaurants in BC. We are seeing in other places governments are asking those types of businesses to either limit their capacity or in some cases even close. And I know some private businesses are also choosing to take their own measures. But what would your message be for them? What's being considered, especially when we're looking at the fact that you want gatherings greater than 50 to be avoided?
Yeah, so that's one of the things that we took into account when we discussed, what's a reasonable number. So yes, I would expect that most bars and entertainment places will not be able to meet that criteria. So we are considering that. I think it's a challenge with restaurants and cafes, and slightly different, where they could possibly maintain separation of people in those settings. Or be looking at takeaway services, for example, as a way of modifying their business practice in this time. So it is very much challenging, and I know it's going to be hard on businesses, it's going to be hard on people, not being able to congregate and not be able to have those special moments together. But those are things that we feel are important right now. To get us through this next period of time, and we will be reevaluating them and reassessing and getting things going again as soon as we can. But right now we need to take these extra precautions, and so I would encourage people, one, not to go and congregate, not to have those major events, particularly if you're somebody who is vulnerable to severe illness from this disease, and we know that that's our seniors and elders in our communities.
All right, last question. Katya Sletkian, Black Press, go ahead.
Hello? Can you hear me?
Yes, we can.
I guess speaking about the seniors, what sort of steps should people be taking to make sure, senior family members, community members aren't isolated but not risking infection, especially as the number of deaths and cases grow?
Yeah, and this is a focus that we've had all along. This is the time where if you should not be going out to gatherings in the community. We need to support our seniors, and there's many ways we can do that. Instead of taking the kids over to visit, maybe a phone call at least. Or many seniors, I know my parents are into FaceTime, and that's how we communicate when we can't be together. So this is a time to look at all of those things. And I would encourage, when we had discussions with our faith-based communities, having ways that we can regularly connect, having people who phone people on a regular basis, or being able to look for seniors in our community that we can assist with picking up groceries for them or their medications. Those are the things that we need to do now to get us all through this part. I know it's going to be challenging for some people, and it's going to be challenging for our children. It's, I've had some conversations over this weekend with young people in my life, and it's concerning. They see the anxiety that we have. They see what's happening on social media. They see what's happening in the around the world, and I think this is a time for all of us to have some quiet time, to spend some time together, to talk about it, to understand that it is a concerning situation, and we don't know everything about what's going to happen. But we can talk with each other, we can stay connected, whether that's remotely or whether that's through telephone. And if you're not in isolation, if you're not a contact, it's okay to go outside and enjoy the sunshine a little bit, spend some time outside with your family in a small group, not with a large group, but spend that family time together right now.
Okay, thank you. That's all the time we have for today.
Thank you. Thank you.